Okay, hi everyone. If I can, thank you. My name is Christine McClure. I'm a student at NUNM. I'm a third year out of 5 in both the naturopathic medicine program as well as the Master's in Integrative Medicine Research program. And I will be the moderator for this panel. What we're focusing on today is pre-metabolic syndrome. So for those in the audience that are not familiar, metabolic syndrome is basically a cluster of conditions or symptoms, and that's where you'll see increased blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol or triglyceride levels. And all of these occur together, which can increase the risk for stroke, heart disease, and diabetes. And pre-metabolic syndrome is basically when you start to see a few of these. They may not be classified as high blood pressure yet, but they're pre-hypertensive. And you're seeing these numbers and these certain cluster of symptoms start to appear, and it's looking like pre-metabolic disease. And today we have an excellent number of candidates on our panel. So if each of you would please just introduce yourself with your name and your degree. We'll start right here with Dr. Berletich.
I'm Dr. Berletich. I'm a DAOM, Doctor of Acupuncture and Oriental Medicine at the Oregon College of Oriental Medicine. I'm a full-time professor there and clinician.
My name is Lai Chim Chan. I am a full-time faculty at the NUNM National University of Natural Medicine. I teach cardiology and pulmonology, and I'm a naturopathic doctor.
Hi, I'm Jenny Nordeen. I am a family medicine doctor, and I teach at the University of Western States Chiropractic College. I also see patients through the Legacy Health Center.
I'm Dr. Daniel Redwood. I am a DC, Doctor of Chiropractic. I was in full-time practice for 25 years. I am now the Director of the Master's Program in Human Nutrition and Functional Medicine at University of Western States.
Sorry, technical difficulties. All right, we'll go ahead and get started on the questions at this point in time. And what we'll do is we'll again start with Dr. Berletich, and then you'll have about 2 minutes to answer or less if you don't want a full 2 minutes. And then we'll just go through and we will end with Dr. Redwood, and then we'll have a moment for discussion. So Dr. Berletich, how is your approach to treating someone with pre-metabolic syndrome similar or different than your approach to treating someone already walking in with a metabolic disease?
Wow, I should have that question in front of me so I can remember it all. Someone with, oh, look at that. Someone came prepared, that's great. The approach is different between pre and someone who has the condition, maybe on a potential level as opposed to an actual level, because ultimately the people that have the condition, your treatments need to be ramped up to a higher level because they're already presenting with multiple things. I would say for pre, my approach would be different from someone who has it in the sense that we're working to prevent the exacerbations that we expect to come about. So how are we going to do that? So that they would be the same, though, in the sense that we're going to be trying to change lifestyle, we're going to be changing habits, we're going to be changing diet, we're going to be changing the things that they're doing that have brought them to this place. So those things will be the same, but what will be different, I think, is if they haven't already started, I would start with lifestyle first, because that's the place where we're going to ultimately get to. And as we all know, that's going to be the most difficult place to change no matter what, because how are you going to change the habits that are habitual that people have that have brought them to the stage that they're in? So I think with that in mind, the earlier you start with changing people's habits and lifestyle, the better off you have. If you look at the classics of Chinese medicine, the foundations of how it thinks about things, if you read about it, the very first thing it talks about is that people that are healthy have a lifestyle that is healthy. It doesn't talk about interventions, it doesn't talk about herbs, it doesn't talk about anything else besides the lifestyle. That's the thing that is what's generating the most diseases, unless it's something that has come from outside of them in, or it's an emotional disease, and everything else is based on lifestyle. So the first place, I think, to start looking is to change that. Seems like 2 minutes.
Yes, I believe it is. Oh, and I'm free. I'm finally off of my tether to the desk. So we have working mic over here, and Dr. Chan, if you'd like to.
I would agree for the most part. So for those of you maybe who aren't familiar with the naturopathic therapeutic order, I just wanted to speak about that very briefly. We have this therapeutic order going from level 1 to level 6. Level 1 is the same idea where we address kind of the foundations of health. And what are the foundations of health? We're talking about diet, whether they're eating a healthy diet, whether they exercise, whether they're sleeping, and then also kind of the mental, emotional aspects of their life. And then what do I mean by this therapeutic order is the first step is to identify what are the underlying causes of disease, what are the conditions for health, and then we kind of move up this hierarchy, with the last one being our interventions become much more aggressive in a sense. In the state of Oregon, naturopathic doctors are we are trained to be primary care doctors, and we are able to prescribe medicines as part of our scope of practice. So what do I mean by we move up that therapeutic order is that we have the ability to prescribe medicines as necessary, meaning pharmaceutical medicines. And then the very last kind of the highest order is surgery. So if people are presenting with pre-metabolic syndrome rather than having that metabolic syndrome, I think we all agree that we want to work on the first foundation of health. And how would I treat them differently if they already have metabolic syndrome? I would move up our therapeutic order and do more aggressive treatments. But I always start with what are their foundations of health, and then kind of meet them where they're at, and that's very important. I see patients at our Beaverton Clinic location, and many of them don't have a whole lot of financial resources, and so in naturopathic medicine, we tend to use supplements that can be kind of spendy. Some of our supplements for balancing blood sugar can be upwards of $30 a month, which is cost prohibitive for a lot of the patients I see. And so sometimes I just meet them where they're at financially. If they can't afford that $30 supplement, sometimes we have to move to that $4 generic pharmaceutical medication. So I guess the answer to this is I meet the patients where they're at, and but always kind of assess the underlying reasons for why they're sick or are progressing to a state where they're not healthy and are getting sick.
Yeah, I would definitely agree with what both of you have said so far, and I just want to say I'm super excited to be on this panel because I just think it's so cool to have just the different perspectives. This is, to me, what integrative